my name is Jocelyn Invernon. I'm a PN student at Williston State College, and today for my skills video, I'm going to be obtaining a clean catch urinalysis. I'm going to be inserting and removing an indwelling catheter as well. So to begin, I'm in my med room, and I'm just going to look over my provider's orders. So it looks like I have Shirley Coast. She's a 54-year-old female. Date of birth is 5/14/1964, and Dr. Leo has ordered us to obtain a clean catch urinalysis. And after that, we're going to insert an indwelling catheter. Then we're going to irrigate the catheter with 30 milliliters of 0.9 normal saline. And then we will be discontinuing that indwelling catheter as well. So I'm just going to make sure I have all of my supplies and it's for the correct client. So it does say Shirley Coast, 54-year-old female, 5/14/1964. So before I go into my client's room, I'm just going to make sure I have everything in order. So we're going to be doing a clean catch first. So I'm going to get all my supplies and put everything else over here. Okay, so first things first, knock knock. Hi Shirley, my name is Jocelyn. Today I'm going to be your nurse. Can I just have you confirm your name and date of birth for me? Shirley Coast, 5/14/1964. That matches my orders and my client's wristband. And I am going to ask my client if she has any allergies. Oh, just to codeine, so no allergies to latex or to betadine. So we are good for the procedure that we're going to be doing today. So Shirley, it looks like I need to get a clean catch on you. Yeah, so in order to do that, I need you to go to the restroom. I'm going to give you 3 cleansing wipes. I need you to wipe from front to back 3 times on the inner labia, outer labia, and down the middle. And my client does have good sphincter control because it's a perfect world. So she's going to begin urinating. She's going to stop, and that's when she's going to start obtaining the clean catch. And she's going to pee as much as she can, preferably around 20 cc's. And then she's going to stop, put this on a clean area, and then finish voiding. So my client has already done that. This is going to be in the bathroom. So I'm going to perform hand hygiene, and I'm going to put some gloves on here. I would go into my client's bathroom. Into my client's bathroom, I would pour the urine that she voided out of the hat into my clean catch container. Make sure and securely put the lid on. And I need to label this. So I have a label. I'm going to make sure that this is the same label as my client's. Shirley Coast, 5/14/1964, and that is the same on my provider's orders as well. So I'm going to go ahead and date, time and initial, and it is 10/15, initial that. Making sure to put that label on the actual cup and not on the lid in case anything were to get mixed up. So I would next put it in my biohazard bag. And I'm going to make sure and delegate this to a CNA or a fellow nurse to help me out and take this straight to the lab. If for some reason we couldn't get it to the lab right away, we would put it in a fridge for it to be chilled. So I would take my gloves off, document the procedure, that my client was able to void with no problems, and that the urinalysis was taken straight to the lab. So next, Shirley, it looks like we're going to go ahead and put that indwelling catheter in. So has the doctor came in and already explained the procedure to you? Yes. Okay, do you have any questions before we begin? No questions. Okay, so first things first, I am going to prepare my work area. So this is going to turn into a bin with warm soapy water in it. I am going to get all of that. Perform hand hygiene. I'm going to go ahead and put on just regular gloves first so I can place a chuck underneath my client just to make sure and protect their bed. And then I'm going to cleanse the perineal area on my client as well before we begin. So I provide patient privacy. I'm going to expose you, Shirley. I'm going to go ahead and use my chuck and place that underneath my client's bum. So go ahead and lift up. Perfect. Awesome. So I would use that warm soapy water, and I'm going to go ahead and just cleanse my client's perineal area. Changing rotating my mitt, cleaning down the middle as well, and drying that really well. Awesome. So that is done. I'm going to take my gloves off, and now I'm going to open my sterile pack. So first I'm going to look at my sterile pack, and I know that it's not expired. The integrity of the package is good. It is the correct size, so it's a 14 French, which is what my provider did order, but I know that's an appropriate size because we have a normal size female, and that would typically work for them. So I'm going to perform hand hygiene, and I'm going to open up my sterile pack. Maybe. So first, I'm going to now I'm going to use this as like a trash receptacle. I'm going to put it at the foot of my client's bed and use my bin here as well. So first things first, I'm going to position my sterile pack in the way that I need it. So I'm going to begin by folding the first flap away from me. Be careful not to cross that sterile field. And next I'm going to open the side flap, the other side flap, being careful to only touch that 1 inch outer margin that is not considered sterile. Grabbing this. Carefully opening that, making sure that it doesn't fold on itself because it would contaminate the sterile field. Perfect. So I'm just going to square this up here. Perfect. And first things first, I'm going to grab my gloves, putting them right here, being careful not to contaminate. And I'm going to use this first. This is not going to be sterile. I'm just going to use this as another protectant for my client's bed. So just kind of place it in the same area that Chuck is already at. And I'm not going to use this either. So that's going to go into the trash. And now I'm going to go ahead and don my sterile gloves. So I'm going to open my sterile gloves, being careful, making sure. Fold those margins out. Only touching that 1 inch outer margin. So the gloves are folded in. Okay, perfect. So I'm going to begin by gloving my dominant hand. So using my non-dominant hand, I'm going to grab the outer cuff here, picking this up, and I can insert my fingers into the glove this way. Only touching this outer cuff because this is what's going to fold onto my skin anyways. And releasing. Now using my sterile hand with my dominant, I'm going to reach underneath the cuff of my glove here and pick that up. And now I know that I can slip my fingers in, making sure to keep that cuff side down and releasing. And my glove did break, and in a perfect world, if this was a real clinical situation, I would get a new pack of gloves and begin the procedure all over again. But for the purpose of the video, we're gonna pretend that didn't happen. So now I'm gonna go ahead and get my box and everything prepared for inserting. So I'm gonna just square that up, and I'm gonna move this over. So I know that I'm only gonna need one of these. I'm gonna go ahead and open this to begin, getting all of my supplies ready. Putting that in the trash. I know that I do not need this. And I'm going to connect my normal saline for the balloon to my catheter. So I'm going to go ahead and uncap. Oh, first, I have to take the sleeve off my catheter. So in order to do this, it already has the little places where I can tear. So very carefully opening this and pulling it off and putting this into the trash. Next, I would, static. Oh goodness, okay, this didn't happen, there we go. Okay, next I would then attach my normal saline syringe to one of the lumens on the catheter. Okay, so now I have that prepped. So now I'm going to cleanse the area of my client. So she did say that she is not allergic to any betadine or latex, so it's safe to use betadine solution on her. So this is the part where my non-dominant sterile glove is contaminated. So I'm going to touch my client, I'm going to spread the labia, and I'm going to cleanse with betadine. So first I'm going to do the outer labia and down, throw that away. The inner labia and down, throw that away. And in the middle, all the way down towards the anus, and throwing that away. Keeping my non-sterile hand there, I'm going to now move the box here onto this cloth over here, being careful not to touch anything, making sure that it is in the correct spot. So I'm going to have my video person lube the 2 to 3 inches. Okay, so I'm gonna go ahead and coil in my hand this part, making sure not to break sterile field, and I'm going to instruct my client that we're gonna begin. So Shirley, I'm gonna begin inserting the catheter. I need you to take 2 deep breaths, and on that second one, I need you to hold it. All right, 1, 2, 3. I'm going to insert. And because the lubricant is not working very well, I don't know if I'm going to be able to get this in. And it looks like now I'm seeing urine, so I'm going to advance this 1 to 2 more inches, so I know that I'm in the safe spot to go ahead and inflate that balloon to keep it the position correct. Just going to make sure that this is up far enough. Hopefully my balloon will inflate. All right, so using my non-sterile hand, now I'm going to hold the catheter in place, and I'm going to use my dominant hand, and I'm going to instill the 10 milliliters of saline into the balloon. And it is not working because the lubricant isn't working. So in a normal world, I would make sure to instill all 10 milliliters of this. All right. I'm going to disconnect that. Okay, so now that the sterile part of the procedure is done, I am going to go ahead and remove the catheter from the box. I am going to make sure and hang it on a part of the bed that can move with the client. So if this was a medical hospital bed and not a massage table, I could hook it under my client's hip level. I want to make sure that no urine could get back up into the bladder after it's already into the bag. And as a extra precaution, I would put this on my client's gown. So next, I'm going to make sure and just hold this in place. I'm going to secure the junction to my client's leg using a piece of tape, like so. I'm going to take my gloves off here. Sterile procedure is done, so I would go ahead and clean up after myself, cleanse the area if anything was visibly dirty, any of that extra betadine solution, and then I'm going to document. I'm going to document any urine output that I got, the color, the clear, the clearancy, and how my client tolerated the procedure. So I'm going to clean up after myself, document, leave my client's room, and then come back for irrigation and removal. So I'm gonna go ahead and clean all of this up. Okay, get all all of my stuff to irrigate, as well as my provider orders. Okay, so I would make sure before I went in, I'm again in my med room, I'd make sure that I have the correct saline, and I have a 0.9 normal saline as ordered. So I'm going to knock, knock, once again confirm my client to my orders, what she says to her wristband, and obviously she was already covered up. But again, I would provide patient privacy. I would expose the area just that I needed to work with. So just the one leg where this is at. I would perform hand hygiene, and this is just a clean procedure so I could put normal gloves on. All right, before I begin, I'm going to, my clamp here, I'm gonna open, this is a sterile irrigation tray. So I would open this up, go ahead and get my, we don't need this, so I'm gonna just dispose of that. I would open this up, pour 30 milliliters into my cup. I would open up my syringe here. I'm going to uncap my needle and get that ready and have that sitting here. Dispose of this in a trash, and I'm going to clean the port before I begin. So I'm going to clean this for up to 30 seconds, circular motions, just making sure no microorganisms get in there before, while using that needle. Perfect. I would get rid of that in the trash. Next, I'm going to use my Kelly clamps, and I'm going to occlude below the junction on my catheter, making sure that nothing can get back this way. I'm going to make sure that my saline is room temperature. We don't want to cause any cramping. So I'm going to go ahead and uncap my needle. I'm going to get 30 milliliters. Perfect. I have 30 milliliters, and then I'm going to insert the needle into that port and making sure that I instill all 30 milliliters of that in. Perfect. I'm going to use the swooping technique to recap this needle, which is okay because it did not go into my client, just into her catheter, grabbing the base to secure that, immediately taking this to the sharps container. So I instilled all 30 milliliters of that. Then I would unclamp this. I would make sure to document all output, make sure that all 30 milliliters that I did put in came back out. Document the clarity, the color, anything abnormal out of the normal. Take my gloves off, put those in the trash. I'm going to clean up my work area, come back, and then we are going to discontinue that indwelling catheter. So I would make sure my client is comfortable, cleaned up, all bed rails up, and leave the room. So I'm going to put all this back. Okay. So next we are going to discontinue that indwelling catheter. So I would perform hand hygiene after I'm already in the room, introduce myself, make sure my client is who she is, orders, and her wristband, explain the procedure, ask if she had any questions, and then provide privacy. I would then expose my client, and I still have that same chuck down there. If I didn't, I would make sure I put a new one. This is also just a clean procedure, not a sterile, so I perform hand hygiene and apply normal gloves here. Okay, Shirley, it looks like the doctor said that we can take that catheter out. Your surgery went well. Awesome. You're feeling better. Good. Okay, so first thing, I would make sure and leave the bag part with urine down below my client's hip to make sure nothing came back into her bladder. If there was a large volume of urine in the Foley bag, I could take it to the bathroom and measure that output first. So what I'm going to do is I'm going to take the tape off, get rid of that. Perfect. And if this would have worked earlier, I would make sure and take out all 10 milliliters of normal saline out of that balloon, which it's not in there, so it's not going to work. I would dispose of this. And then I'm going to get a hold of the catheter. All right, Shirley, on 3, I'm going to have you take a few deep breaths, and on that second one, I need you to hold it. So I would secure my client's, spread my client's labias and secure the catheter in my dominant hand. Okay, Shirley, on 3. 1, 2, 3. I'm going to pull that out quickly. I would wrap it in my chuck, getting it and disposing of it per facility policy. One thing that I would make sure to document is that the tip of the catheter is intact. That is important because sometimes it could break off and be inside of my client. So tip is intact, make sure to document that. I'm gonna dispose of this per facility policy. I would use warm soapy water, cleanse my client's area once again, making sure she's nice and clean and dry. I would take my gloves off, cover my client up, and then educate my client on the next 8 hours. So Shirley, it's extremely important that the next 8 hours, we need you to void into a hat. I put it in your bathroom there. We just need to make sure everything's working after we took that catheter out. So it's really important to make sure that your client voids twice within that first 8 hours and a good volume. Next, I would document and make sure, I would document that that tip was intact, how my client handled the procedure, any of that output that was still in that Foley catheter as well. And make sure she's comfortable, she has her call light, bedside rails are up, clean up my station and leave the room.